Fibromyalgia, Connecting Luo Channels, Part 2. There is also a deeper layer of connecting channels which lies beyond that of the main channels. The channels in this deeper layer can be called the deep connecting channels, and they are energetically related to the blood vessels and blood in general. These deep connecting channels are involved in chronic pain from blood stasis, as sometimes happens in fibromyalgia. So here we see the energetic layers of the main and connecting channels and the types of qi. Another figure that illustrates the energetic layers of main and connecting channels. We can relate the three layers in the channel network to types of qi, that is defensive qi, nutritive qi, and blood as follows. On the surface, the connecting channels, we have the defensive qi level. In the center, the main channels, qi and nutritive qi level. In the interior, the deep connecting channels, blood level. Chapter 66 of the Spiritual Axis mentions the different energetic layers in connection with the invasion of external pathogenic factors. So here we can see the progression of external pathogenic factors in channels. When pathogenic factors invade the body, they invade the skin first. When the skin is relaxed, the space between the skin and muscles is open, which allows the pathogenic factors to move from the hair to a deeper level. When they do so, the hair stands on end, the patient shivers, and there is pain in the skin. If the pathogenic factor is not expelled, it enters the connecting channels. When it is there is muscular pain. When the pain ceases, the main channels will be painful instead. If the pathogenic factor is not expelled, it enters the main channels. When it is there, the patient shivers and is startled. The passage goes on to describe how the pathogenic factor progresses from the main channels to the acupuncture points to cause pain in the limbs and stiffness of the back, which is what happens in fibromyalgia. Then to the penetrating vessel, causing heaviness and pain, then to the stomach and intestines, causing abdominal distension and diarrhea, then to the membranes, and finally to the blood vessels, causing abdominal masses from blood stasis. In the context of fibromyalgia, when the pathogenic factor is in the blood connecting channels, there is blood stasis and severe pain rather than a dull ache. External pathogenic factors generally invade the connecting channels first. They also invade the muscle channels. If it is only the muscle channels that are invaded, the main symptoms are simply stiffness and pain of the muscles without any internal manifestations such as sore throat, fever, etc. This is the pathology of fibromyalgia in which both the muscle and the connecting channels are invaded by dampness without symptoms of exterior invasion. When wind penetrates a connecting channel, it causes the typical initial symptoms of invasion of wind, that is, aversion to cold, fever, skin hot to touch, sore throat, floating pulse. Wind generally invades the lungs, large intestine, and stomach connecting channels. In fibromyalgia, the main symptom indicating an invasion of wind in the muscles is a wandering ache that moves from place to place. Invasion of external dampness in the beginning stages also causes aversion to cold and fever, and, in addition, nausea, vomiting, diarrhea, a feeling of heaviness, and swollen glands. It primarily invades the large intestine, stomach, spleen, and liver channels. If dampness is not expelled, it easily becomes chronic, settling either in the space between the skin and muscles or in the joints. The settling of dampness in the space between the skin and muscles, energetically corresponding to the connecting channels area proper, is often seen in post-viral fatigue syndrome and fibromyalgia. External cold causes pain and contraction. When it settles in the muscles and in the space between the skin and muscles, it causes a more intense pain than that from dampness, and it is not so generalized as that from dampness. Thank you for your attention.